Hello, I'm Lou Goodall and I'm the Clinical Lead for Education in the research team, and I'm delighted to have Anne Maloney with me today, who's the Head of Nursing for Cancer Services and has been instrumental in creating some amazing opportunities for research to be embedded in practice in the cancer division. So I'm going to ask Anne a few questions about her involvement in research to give us some good ideas about what we can all do. So thanks, Anne, for taking the time to join us today.
Well, thank you for inviting me, Lou.
It's a pleasure. Can you tell us, first of all, a bit about what's the driver behind embedding research in practice in the cancer division for you?
Yes, there's a couple of things. There's a national framework which is called Ascend, and that's about the educational framework and progression of nurses in the cancer division, and also the 4 pillars of advanced clinical practice, which we want all nurses to be able to achieve, and research is very much part of one of those pillars.
Yeah. So research forms a pillar, and then also it's in this Ascend plan, is it? So any nurse working in the cancer division has got research kind of on their remit as part of the Ascend career development.
So anybody new that comes into the cancer division can work with that framework and self-assess against the capabilities, and the research is one of those domains.
Right, okay. So Anne, tell me about how you became interested in championing research in your role.
My first experience was when I undertook my master's, and that's about 2013, I think, alongside with yourself. And part of my research was about metastatic spinal cord compression and our 7-day pathway we had UH Sussex, and benchmarking that against the other research. So that was my first experience. And the second one was when we both developed the Fundamentals of Cancer Care course for all grades of staff at University Hospital Sussex. And that is a 6-month programme, CNS-led, but the assignment is very much research focused on a question they want to improve their practice. So either provide a leaflet or a postal, or how they improve in practice.
Yeah.
So, and part of that is engaging in research, doing a research literature search, and completing an assignment. And that's been going since 2018, twice a year, and it's always fully subscribed. So it's a very
large numbers of that. That's 60 a year, isn't it? We managed to get on the Fundamentals of Cancer Care, which is incredibly impressive. And I think for me, when we were putting that module together, that also really highlighted the need to ensure that what we're teaching on that module is absolutely based in evidence and is the latest evidence. So of course that links back to research as well.
And the research team were part of that. In COVID, we couldn't do the face-to-face, so we did a lot of filming, and research did a film section about research, and they've also got a chapter in the workbook which we give participants as a resource. So they're very much part of that.
Yeah, it is embedded right through it, isn't it? Yeah, fabulous. And then, of course, we're looking now at hopefully linking up our Fundamentals of Cancer Care with our in-house evidence-based practice course to kind of bring the two together for people to be able to do both of those courses.
We're getting that accredited at Chichester University. So if we can offer that alongside the Fundamentals of Palliative Care and maybe another course, they can take that and embed research into that and have a accredited PGD.
Yeah, amazing. So we've got it kind of academically and clinically woven in all sorts of different ways. So can you tell me about the developments that you've put into place to help staff and patients get involved in research in practice?
Yeah, so as research is one of the 4 pillars, it's really important to start looking at job planning, making sure that we can encourage and support our CNS team in the cancer division to become involved and engaged in research. So how do we do that? So we need to look at their job plans and give them time to be involved, and they can be involved as little or as much as they like. There's lots of opportunities in research. So job plan them, put it into our job description, our generic job description, that research is an important part of the CNS role. So we know that research has better patient outcomes, and then how we disseminate that learning between us as well, and offer our patients the latest trial or the latest information, so we get a better, wider range of patients engaging in research.
Have you been involved in supporting people in undertaking their research projects of their own in practice? Do you have like huddles and regular meetings and those kind of things where you can get it out to the people who are working day to day?
Yeah, so as you were
clinically?
saying, appraisals is an important part of actually how do we develop our staff. We have daily huddles and we can disseminate the information there. We have a webinar that the cancer division have monthly, so we can invite people to have a 10-minute presentation about what they've learned. So it's about actually disseminating our learning and encouraging people to become more engaged.
What practical things would you recommend that staff can do to become more engaged in research in practice?
Well, as I say, they can become engaged as little or as much as they want. So they can become involved in the consent process. They can become a investigator or an associate investigator. They can even think about a research question in their own team. So what process am I not sure about? What do I think I can improve? And then go with the research team and say, how do I research this? They could also become involved in the fundamentals of cancer care, the educational program we've got, and that's very much research driven in their assignments. So there's lots of avenues they can take.
So there's kind of academic avenues and clinical avenues depending on what people prefer. Luke, can you tell us a little bit more about the prehabilitation programme for cancer patients that you worked on at University Hospital Sussex?
Yeah, sure. We know people undergoing treatment for cancer, whether they're having chemotherapy or having to undergo surgery, have their body placed under considerable strain. And we know that people who are active and are fit do better, they're less likely to have complications related to the treatment, which could entail hospital stays. And there's gathering evidence that if people undergo exercise before and also during treatment, such as chemotherapy and surgery, those people do better, both in the short term and the longer term. And so we were working on ways in which we could deliver prehabilitation in different ways depending on the patient's preference and what could be done. So, for instance, we know that some people prefer doing exercise in classes, whilst other people might prefer to do home-based activities. So, producing exercise videos with the help of Anna and her team, and using sort of digital technology to help support people through their cancer journey.
And was it successful? I mean, what were the findings?
Yeah, I mean, the research has demonstrated that it's certainly acceptable to partake in this sort of activity. The very good patient feedback was received from the programme, as well as the sort of more novel aspects of the study we were doing. And it really gave, I think, the team a good sense of the importance of doing research whilst at the same time trying to improve care services. It's always a challenge trying to introduce new things when there's constraints on the amount of staff and the amount of money that's available to the health service, but trying to incorporate research at the same time as working out ways to better deliver care. I think the team found it a useful process and have continued on that in the future.
Right, so you think it sort of helped to engage the team in what research in practice is all about if they may not have had a chance to be involved before?
Yeah, exactly.
Yeah.
And understanding the importance of physical activity, as even though somebody's unwell, the fact that we understand now that actually getting people more active can actually help them to undergo their treatments is quite an important thing for any condition, but particularly with people with cancer.
Yeah.
What we found whilst doing the work with the cancer patients was that even a short period of time, so 2 weeks in a number of cases, was enough to have an impact on people's ability to tolerate interventions like chemotherapy and have a positive impact. So it's quite powerful knowledge that was gained from doing the study.
Okay, so is there anything you'd finally like to add, Anne?
Well, I think listening to Luke earlier, I think we need to be champions for research. We need to embed it in our job plans. We need to motivate our staff. And as we know, patient outcomes are much improved through research. So we can do a lot more, I think, to educate our patients and engage with them.
Brilliant. Thank you very much, Anne, and thank you for taking the time to talk to us today.
Thank you for asking me.